Good afternoon. No signal. I'm Siobhan Hartline Bradley, and I'm the Senior Director of Health Programs for the National Office of the NAACP. And our statement is as follows. The National Health Department of this country's oldest and largest civil rights organization, the NAACP, stands in affirming the role of civil rights advocacy strategies and social justice to help reduce barriers for increasing opportunities for active play and healthy eating, along with physical activity options. In order to understand disparities and barriers to obtaining health equity, one must have the courage to address this country's historical and present issues with racism and classism, as well as the dynamics of perceived political and social power. The cry of the people is for the public health community to not just see communities of color, but hear and include them beyond the standards of set by community-based participatory research, but also by the conviction of us, public health organizers, as a sector who realizes the potential of health equity in the advancement of a healthier America. Over the years, there's been a major focus on reducing disparity gaps in our community, while missing opportunities to galvanize a healthy balance of grassroots organizing for policy change and a variety of programs that have ample resources to support long-term changes. The NAACP speaks a language of justice and equity first, followed by issue area organizing. We represent a constituency of all races, all ethnicities, that view the built environment as a potentially game-changing opportunity. According to the social ecological framework, individuals make decisions and are directly affected by the communities and institutions around them that have lasting impressions on our behavioral choices. Changing a community's physical environment is one step in a long journey toward reversing childhood obesity and adult obesity in the United States. Policies that improve accessible opportunities for physical activity do not, however, change the political and social landscape of many communities of color. This requires an adjustment in our community's understanding of how race, place, and income can alter one's ability to not be physically active, but live a healthy life. As a public health advocate, I've seen recommendations across this country made with inequity and disparities as an important thought, but not an American standard. So the NAACP nationally offers the following considerations. There are three. One, framing proposed plans to advocate for policies, including the built environment, that will affect communities of color, require those communities to not only be educated and briefed on the problems, but also be included in the process toward passing comprehensive pieces of legislation and institutional policy that will be felt by all Americans. Number two, to increase physical activity in communities of color as a standard and accessible part of life requires economic commitments from the business community, government, public health, and public planners. Economic resources should not only be from federal grants, but must feature a diverse portfolio of funding. And finally, contrary to many opinions, communities of color do have an interest in equitable access to parks, play, and community development. There must be, however, a commitment to disseminate those findings of disparate access and disparate use of parks and opportunities for play to be translated for communities of color to have an active voice in pursuing long-term policy change. Thank you.
Thank you. Next, Jason Pelzel, International Food Information Council, will comment on panel one.
Hi, first of all, I'd like to thank all the panelists for your valuable insights that you shared today. And I'd like to make a brief comment just related to the first panel about building physical and social environments for physical activity. What will it take? In my public health and my clinical training, I always learned that an intervention was based on a thorough assessment. And if we're going to talk about solutions and accelerating progress, we also have to talk about community assessments. I think that these two go hand in hand. And as has been acknowledged here many times, there likely is no one-size-fits-all approach. There likely is no one-size-fits-all solution, and what it will take in one community likely differs from what it will take in another. And so I think that this underscores the importance of community assessments so that we can provide tailored interventions that meet the specific needs of high-risk groups. And so do we have the time and the professionals in place at local levels that are equipped to do this? As Dr. Floyd mentioned, not having the expertise was a barrier to gaining funding from the philanthropic organizations. So I think that we need to ask ourselves, are there ways that we can more efficiently and effectively conduct community assessments and be able to leverage the existing resources as well as potential champions that are there? Are there new approaches, new technologies, new data sources? Are there partners, potential collaborators such as the Cooperative Extension Service that have field agents in the field already who might be trained in community assessments and can provide some valuable expertise regarding the existing capacity and potential champions. In closing, I think that the discussion around community assessments deserves some further emphasis, and I think it's essential that we have a framework at the local level to empower local professionals to conduct community assessments in order to, as I mentioned, leverage the existing capacity as well as identify those gaps where additional capacity building is needed in order to target specific needs of individual communities. Thank you.
Thank you. Next, Linda Thompson of Howard University.
I've enjoyed the panel today. In addition to being an assistant professor at Howard in the Nutritional Sciences Department, I am also on the board of directors of the Ward 8 Farmers Market, which is located in a low-income community in the District of Columbia. And we find that farmers markets established in low-income communities provide healthy, affordable food choices to residents, as well as opportunities to provide information and activities to support obesity prevention. Particularly producer markets where farmers grow their own food offer fresh-picked, competitively priced produce. And some markets, particularly those in D.C. that are in at-risk communities, double the value of SNAP, EBT, WIC, and senior farmers market vouchers through a grant program. So we have people that come in and maybe buy $5 worth of produce. They get $5 worth of produce dollars that they can either spend during that market or they can come back later. And we have found that they have accumulated a lot more dollars so that, say, at the end of the month, when their SNAP monies run out, they can come back to the market with these vouchers and continue to purchase produce. We've also found that markets help with respect to health screenings. We provide nutrition education, food tasting, food demonstrations. So it's really helped to expose people to how to prepare fresh fruits and vegetables. We also have activities for children while their parents are shopping. So it's a great, safe environment for people to gather. We find they share information about recipes and about trying new foods. And there are many teachable moments at the market. The biggest challenge that we found is getting people to come to the market. Last year, we raised some funds to get a free shuttle that stopped in about 6 sites in Ward 8 to bring people to and from the market, and it was a rotating shuttle for about 4 hours. We had minimal participation. So I think one of the challenges, or the major challenges, making these markets of value to the target population. Once those that come enjoy coming and come back, but those that have never come don't, for some reason, don't feel the need to come. So that's a really big challenge. Marketing is certainly an issue. This year we're starting a texting program where we're getting cell phone numbers and texting information to the market. We're trying to find ways to reach people in low-income communities that may not have access to a computer through social media. We're Twitter, we have a website. Again, now we're starting to text, so finding ways to bring people in. And just a quick comment about getting people in the neighborhood in terms of advocating for themselves. I've been involved in some peer educator programs in the district in Ward 8 that have been very successful in working with their community members, not community health workers, but peer educators who go to community meetings and talk about, we had peer educators talking about farmers markets and the importance of increasing fruit and vegetable consumption. So peer educators can be used for various topics: obesity prevention, increasing environmental access to for physical activity. So we've used peer educators through a group called Summit Health Institute for Research and Education, who's done a lot of work in peer educating in Ward 8. Thank you.
Thank you very much. Heather Hartline Grafton of the Food Research and Action Center will comment.
Good afternoon. I am Heather Hartline Grafton, Senior Nutrition Policy and Research Analyst at the Food Research and Action Center. FRAC is committed to addressing the obesity issue as it affects low-income people and as it interacts with poverty, economic insecurity, and food insecurity. And we at FRAC urge the Standing Committee to acknowledge that virtually all of the workshop topics ultimately involve the cross-cutting issue of growing inequality, declining assets and income for the bottom part of the population, and growing economic insecurity. So in other words, the obesity problem and disparities in healthy eating and obesity will not be solved without higher employment rates, more full-time jobs and better wages and benefits, stronger income supports and federal nutrition programs, and quality health care for all. Many discussions of obesity prevention seem to ignore or give short shrift to these solutions, but we challenge the committee to tackle them head-on. So in the remainder of my time, I want to talk more specifically on the issue of food access. A number of initiatives have been implemented to increase access to healthy, affordable foods in underserved communities, including the development of new grocery stores, renovation of existing stores, and expansion of farmers markets. And these are all great initiatives. However, while improving retail availability and convenience is important in combating inequity in food access, research shows that such efforts alone will not solve the problem. To this end, we offer the following to the committee. First, we need to increase benefit levels for participants in the Supplemental Nutrition Program, or SNAP. Benefits currently are too low to stave off hunger for a month, much less allow a family to purchase a healthful diet. And I refer you to the recent IOM report on SNAP benefit adequacy. Second, we need to assure that support for federal nutrition programs is connected to access to healthy food retail opportunities. So for example, retailers receiving incentives for development or locating in underserved communities should be required to not just accept SNAP and WIC benefits, but also to support rigorous SNAP and WIC outreach efforts in the community. And finally, we need to assure that the foods offered in these healthy food retail outlets are affordable, of high quality, and culturally appropriate. If such steps are not taken, why would we expect families to shop at these establishments? So we appreciate this opportunity to share our ideas.